Can employers give their employees better health care, or do they just care about costs? Hello, I'm Dr. Stephen Schimpff. This is a continuing series on the crisis in primary care. The last few segments I've talked about direct primary care and about what retirement communities can do to give better care for their residents. Today, a little bit about what employers can do. And it really falls down into two categories. One of them is for the employer to say, look, I will pay the retainer or the membership for that direct primary care practice. I want you to get that to that doctor who's going to give you that extra time to really focus on wellness and health and prevention, and to take good care of your chronic illnesses, because I realize that that will reduce total costs of care. And since I, as the employer, am paying a good portion of your health insurance bill, then that's going to be to my employer satisfaction, advantage, if you will. So that's one way. Not too many are doing it, but they're beginning to catch on. And in fact, many of the direct primary care practices that I described a couple of sessions ago are finding that a lot of the growth in their practices are from employers who are saying, I really want my employees to come to you because I know they're going to get better care, and that's going to drive down my costs and actually also drive down absenteeism. Now, the other approach is for the employer to say, hey, I'm large enough, it makes sense for me to actually put a clinic, maybe on site or just down the road a bit. Usually when this is done, they contract with a company, an outside company that does this sort of on a turnkey basis. And the key, though, is that that physician to employee ratio has to be such that there's plenty of time for each visit. And when that happens, again, the employer will discover that their employees are more satisfied, the total cost of care are coming down, the health of their employees is better, so they're also saving on less absenteeism. So a couple of different ways that employers are learning that they can have an impact, have a healthier workforce, and yet a lower total cost of health care.